Hello, everyone. So for this chapter 8, we're covering drug use and addiction. Following this chapter, we will be able to define and discuss addiction, explain factors that contribute to drug use and the misuse of drugs, list risks associated with drug misuse, understand how drugs affect the body, list and describe the effects of the 6 major classes of psychoactive drugs, and outline risks and ways to prevent drug-related problems. A couple of key terms to go over before we start is the definition of a drug is any chemical other than food intended to affect the structure or function of the body. And a psychoactive drug is a drug that can alter a person's consciousness or experience. We'll also cover terms such as tolerance, which is a lower sensitivity to a drug or substance so that the given dose no longer exerts the usual effect. And we'll also be going over substance misuse or abuse, dependence, and substance use disorder. So, like I mentioned, drug is any chemical other than food intended to alter or affect the structure or function of the body. So drugs most often associated with addiction and impairment are psychoactive drugs, which alters a person's experiences or consciousness. And psychoactive drugs can cause intoxication, which is a state that can involve unpredictable physical and emotional changes. So, addiction is a chronic disease that disrupts the brain systems that regulate motivation and reward. The American Psychiatric Association defines addiction as compulsive drug seeking behavior, and addictive behaviors are habits that are out of control and that negatively affect a person's health. There's nearly a uncontrollable pursuit of physical or psychological reward and or relief through substance abuse or behaviors um, that are other addictive types of behaviors. Changes in brain chemistry underline addiction. So certain activities such as eating or gambling may trigger the release of brain chemicals that produce pleasure in the same way that psychoactive drugs do. And one brain change is tolerance, in which the body adapts so that the initial dose no longer produces the original emotional or psychological effects. And although brain chemistry seems to influence addiction, an individual still bears responsibility for their own addictive behavior. Other factors such as lifestyle and personality traits play key roles in the development of addictive behaviors. So being able to diagnose substance misuse and addiction, substance misuse is a use of a substance that is not consistent with medical or legal guidelines, and addiction is a psychological or physical dependence on a substance or behavior that has undesirable negative consequences. And the severity of substance use disorder is determined by the number of criteria from the American Psychological Association's DSM-5 that a person meets. So 2 to 3 criteria indicate a mild disorder, 4 to 5 criteria point to a moderate disorder, and 6 or more criteria is evident of a severe disorder. And the DSM-5 criteria include the following, which are grouped into 4 categories. The 4 categories are impaired control, social problems, risky use, drug effects, including tolerance and withdrawal. And the latest version of the DSM dropped the past distinction between dependence abuse and diagnosing drug-related disorders. So many potentially addictive behaviors can be harmless, even beneficial if done appropriately and in moderation. And addiction often starts when a person does something to bring pleasure or avoid pain. Reinforcement leads to increasing dependence or behavior, and tolerance develops, and the person will need more of the substance or behavior to feel the expected effect. So when the behavior no longer brings pleasure, but repeating it is necessary to avoid withdrawal, that can also most definitely be a sign of addiction. And many common addictive behaviors include shopping, drinking, eating, um, and these factors that influence whether they become problematic include personality, lifestyle, heredity, and the social and physical environment and the nature of the substance of the behavior. So other types of behavioral addictions include compulsive gambling, video game disorders, compulsive exercising, work addiction, sex addiction, and compulsive buying or shopping, and internet addiction. So there's many different reasons why people use drugs. Drugs have been used to alter consciousness since prehistory, and plants were often used for religious, medicinal, and personal reasons. So the allure of drugs for young people, it may be um, to for excitement and because they're illegal, it's kind of like a rebellious behavior. Many users are motivated by a desire to um, escape boredom. If they have anxiety or depression or feelings of worthlessness or other symptoms of psychological problems, they may use drugs as a way to cope. So drug users come from all income and educational levels, all races and ethnic groups, and all age groups. But addicts tend to share some of the same characteristics. So factors associated with someone who's more likely to try drugs are males compared to females. Males are twice as likely as females to abuse illicit drugs. Those with troubled childhoods, teens are more likely to try drugs if they have behavioral issues in childhood, have suffered some kind of sexual or physical abuse, may have used tobacco at a young age, or suffer from certain mental or emotional problems. There's also thrill-seeking individuals whose impulsivity and a sense of invincibility is a factor in drug experimentation. So if someone has a dysfunctional family, they might, and a chaotic home life, they might be more likely to use drugs, especially if they experience parental abuse. This can increase the risk of drug use at a young age. A peer group that accepts drugs use as another factor. Young people who are uninterested in school and earn poor grades are more likely to try drugs, or people who are economically disadvantaged may be likely to try drugs at a young age. And adolescents engaged in risky sexual behavior, um, like dating older um, people, are more likely to use drugs as well. So there are some factors that are associated with people that don't um, move towards drugs, and that includes positive self-esteem, assertive independent thinkers, people with a high sense of self-control, social competence, optimism, high academic achievements, religiosity, and open communication and support from parents. So the risk associated with drug misuse, in 2016, over about 600,000 emergency room visits related to drug misuse or abuse reported, and the number could really be as high as 1.3 million. Other serious concerns include intoxication, which is people under the influence of drugs who are more likely to be injured from a variety of causes and may be involved in incidences of aggression and violence. Unexpected side effects have are both physiological and psychological. They can range from nausea, paranoia, depression, heart failure, and the risks of fatal overdoses. Also, unknown drug constituents. There's no quality control in the illegal drug market. So the composition, dosage, and toxicity of street drugs is highly variable and very dangerous. There's also infection and injection drug use associated with higher rates of HIV and hepatitis C. So people may share or reuse needles, syringes, and other injection equipment, which can easily be contaminated with other users' infectious blood. And legal consequences of drug use include large fines and imprisonment because they are illegal. So drugs affect the body in many different ways. First, changes in brain chemistry. The more quickly a drug reaches the brain, the more likely the user is to become dependent on the drug. And when a psychoactive drug reaches the brain, it affects neurotransmitters by increasing or decreasing their concentration and actions. For example, cocaine affects dopamine, which is a neurotransmitter that plays a key role in the process of reinforcement. And a duration of a drug effects depends on many factors. And as drugs circulate through the body, they're metabolized by the liver and excreted by the kidneys in the urine. So with that being said, duration of a drug's effect depends on many factors and can range from 5 minutes to up to 12 or more hours. Physical factors include body mass, general health, general factors, concurrent use of other chemicals, and pregnancy. The use of any drugs during pregnancy definitely carries risk to the fetus. Psychological factors include response being affected by user expectations, and psychological and social factors being important when smaller doses are given. Also, the placebo effect occurs when a person responds to an inert substance as if it were an active drug. Social factors also play a role in how drugs affect the body, including the setting and the physical and social environment surrounding the drug use. Using it at home might have effects different than using it at a party or in a laboratory setting. And the setting and the user's expectations have greater effects than the drug itself. So different groups, there are different groups of psychoactive drugs. Major psychoactive drugs are opioids, central nervous system depressants, central nervous system stimulants, marijuana and other cannabis products, hallucinogens, and inhalants. So opioids are narcotics, are natural or synthetic drugs. They're designed to relieve pain. They cause drowsiness and induce euphoria. In small doses, opioids have beneficial medical uses, including pain relief and cough suppression. Examples include opium, morphine, heroin, methadone, codeine, hydrocodone, oxycodone, and fentanyl. Opioids also reduce anxiety and produce lethargy, apathy, and the inability to concentrate. Although opioids are taken to produce euphoria, many first-time users can experience uneasiness. And the abuse of opioids often results in dependence, and tolerance develops quite rapidly. So the growing epidemic in the United States is largely due to intravenous heroin, fentanyl, and carfentanil use. And symptoms of opioid overdose include respiratory depression and death. So the use of prescription painkillers like oxycodone and hydrocodone in large doses or with other drugs also leads to misuse and addiction and even fatal respiratory depression. So central nervous system depressants slow the activity of the central nervous system, and effects range from mild sedation to death. Types of central nervous system depressants include barbiturates, anti-anxiety agents, methacholine, F-chlorovinyl, sorry, and chlorohydrate and GHB. And Z drugs include sleeping pills like Ambien, Lunesta, and Sonata. And the effects are that they reduce anxiety and cause mood changes, impaired muscle coordination, drowsiness, or sleep. Mental functioning is also affected, although effects differ in different degrees. So medical uses, they can be used to calm people before surgical or medical procedures, and used in a combination with other anesthetics before operations or dental procedures. And people are usually introduced through a medical prescription or drug using peers. So people start to use CNS depressants either because they have a prescription or because they're given some by their peers, and it's then easy to increase the dose or frequency in attempt to increase the effect, which can lead to dependence. Most CNS depressants can lead to classical physical dependence, tolerance, and withdrawal, and tolerance sometimes is up to about 15 times the usual dose and can develop with repeated use. Withdrawal symptoms can also be associated with shaking, anxiety, convulsions, cardiovascular collapse, and death. And the use of depressants can produce mental confusion and negative emotional effects, as well as impaired judgment and physical coordination. There's also what's called club drugs. They have negative effects and are potent and unpredictable when mixed with alcohol. Rufinol, like Rufinol and GHB. Rufinol is a sedative that's 10 times more potent in volume, and it affects are magnified by alcohol. And effects include reduced blood pressure, dizziness, confusion, gastrointestinal disturbances, and loss of consciousness. It's also called the date rape drug because it also causes anterograde amnesia, which is a loss of memory of things occurring while under the influence, and it can also be fatal when combined with alcohol. So GHB is a central nervous system depressant that, when combined with other depressant, causes sedation, loss of consciousness, respiratory arrest, and death, and may cause prolonged and potentially life-threatening withdrawals. So central nervous stimulants are speed up the activity of the nervous or muscular system. Your heart rate accelerates, blood pressure rises, blood vessels constrict, gastro and adrenal secretions increase, muscular tension and motor activity increase, pupils and bronchial tubes dilate, blood vessels constrict, and wakefulness is common. The most common CNS stimulants are cocaine, amphetamines, nicotine, ephedrine, and caffeine. So cocaine usually snorted or absorbed through the nasal mucosa, or snorted and absorbed through the nasal mucosa, or injected for more intense effects. Cocaine is processed with baking soda and water, producing can also be processed with baking soda and water, and it produces crack cocaine, which is a ready to smoke form of cocaine, available as beads or pellets. So cocaine produces almost immediate, intense, and short-lived effects, including 5 to 20 minutes of euphoria, but it could be followed by irritability, anxiety, or depression. And the larger the dose, the more rapidly it's absorbed, the greater the immediate and potentially lethal effects. Sudden death is most commonly the result of excessive CNS stimulation that causes convulsion, respiratory collapse, irregular heartbeats, high blood pressure, and blood clots that lead to heart attacks or stroke. And chronic users often develop into irritation of the nasal mucosa and bleeding and ulceration of the nasal septum. The use of cocaine also can cause paranoia and aggressiveness. And to produce a desired effect, cocaine has to be taken quite frequently to relieve the depression that accompanies withdrawal. So amphetamines, they're also known as uppers, and they're synthetic chemicals that are potent CNS stimulants. They include amphetamine, dextroamphetamine, and methamphetamine. Crystal methamphetamine, or ICE, is a smokable high-potency form of methamphetamine, and it quickly leads to addiction. Small doses of amphetamines usually make people feel more alert. They increase motor activity, but do not alter a rested person's ability to do complex physical tasks or perform high-level thinking. And because they speed up the body processes and suppress the appetite, amphetamines also have been used as diet aids and are for weight control. And their effect is short-lived. However, definitely not recommended to use for that type of to use at all. So amphetamine misuse begins with attempts to cope with a temporary situation. The performance of students who use drugs to study and take tests may drop radically when the drug is not available. Continued use leads to tolerance, and increased doses can produce temporary psychosis in some cases, characterized by episodes of paranoia and unprovoked violence. So methamphetamine is probably the most addictive form, and it's more toxic and its effects last much longer. Short-term effects include rapid breathing, increased body temperature, insomnia, tremors, anxiety, convulsions, and high-risk sexual activity, which increases the rates of STIs and HIV. Long-term effects include weight loss, severe acne, hallucinations, paranoia, violence, and psychosis. And other physical effects include teeth decay, tooth loss, heart, and brain damage. So addiction is associated with a pronounced psychological craving and obsessive drug-seeking behavior. And also when amphetamine is used during pregnancy, it's associated with stillbirth, low birth weights, and early infant death. Infants exposed to this type of drug are more likely to develop cleft palate, cleft lip, and deformed limbs. And when born, a baby can actually experience withdrawal from withdrawal symptoms from the amphetamine. So stimulant ADHD medications such as Ritalin have stimulant effects similar to those of amphetamine. However, it is used to treat attention deficit and hyperactive disorder. When taken orally as prescribed, it has little potential for abuse, but dependence can quickly develop if it is injected or snorted. Caffeine is a very popular psychoactive addictive substance, and it's probably one of the oldest. It's found in teas, coffees, cocoa, soft drinks, headache remedies, and over-the-counter prescriptions. It produces alertness and a sense of well-being and reduces feelings of fatigue or boredom. It also mildly stimulates the heart and respiratory system, increases muscular tremors, and enhances gastric secretion. Caffeine use by people who have high blood pressure can cause blood pressure to rise further above normal. And in higher doses, it may cause nervousness, irritability, headache, sleeplessness, and gastric irritation or peptic ulcers. In people with type 2 diabetes, caffeine also may cause insulin levels to rise after meals. Although caffeine-containing drinks are rarely harmful for people, caffeine does induce dependence. Reactions to caffeine withdrawal often include irritability, headache, or mild depression. So there's also energy shots, which are not regulated by the FDA, and they're sold as dietary supplements. So the caffeine content is not regulated by the Food and Drug Administration. Each 2-ounce shot contains about the same amount of caffeine as a regular sized cup of coffee. So marijuana and other cannabis products are the most widely used drug in the United States. Although legal status is changing, there's 33 states in the District of Columbia that have currently legalized medical marijuana, and 11 states and DC have legalized marijuana for recreational use. So THC is the main active ingredient, and the potency of various marijuana preparations depends on the THC concentration. The average potency of street marijuana has increased over the years. So short-term effects and uses, low-dose effects include euphoria, heightened subjective sensory experience, and a low sense of time and slowed sense of time and relaxation. Moderate doses can lead to impaired memory function, disturbed thought patterns, lapses in attentions, feelings of depersonalization, and sometimes feelings of which the mind seems to be separated from the body. Very high doses produce feelings of depersonalization, sensory distortion, and changes in body image, where users can experience anxiousness or panic, the sensation of panic. Unexpected reactions have resulted in an increase in emergency room visits. So marijuana causes increase in heart rate and dilation of blood vessels in the eyes. So users may feel less inclined toward physical activity and feel hungry or thirsty when taking the drug. So THC affects the part of the brain that affects balance, coordination, and reaction time. And so marijuana does have an effect on driving performance, and it can be dangerous when combined with alcohol. So state laws legalizing marijuana do not supersede federal laws. Anyone using or selling marijuana can still be processed and prosecuted under federal drug laws. However, research does show some benefits for using marijuana to treat muscle spasms and multiple sclerosis and cancer-related types of pain. Long-term effects of marijuana um, is can include respiratory damage, and there may be an increased risk of emphysema. Among people with chronic conditions like cancer and AIDS, marijuana can be associated with lung infections. Also, THC use during pregnancy may impair the infant's early motor development. So next is hallucinogens, and hallucinogens are drugs that alter the user's perception, feelings, and thoughts. So LSD is probably the most used hallucinogen, and it produces very powerful results in the form of altered sense of time, visual disturbances, improved hearing, changes in mood, distorted body perception, dilated pupils, dizziness, weakness, and nausea. Larger doses of LSD produce syn- sorry, synesthesia and are other alterations in the perceived relationship between yourself and the external reality around you. So effects from low doses are largely determined by the expectations and the setting. Effects are difficult to describe because they involve altered states of consciousness. Some people have used LSD to experience altered states or to explore their own psyche through religious or mythical drug-induced experiences, and users are always subject to a panic reaction regardless of the dose or situation. You also may have spontaneous flashbacks